If we look at what and they have this article out today suggesting that a possible Obamacare worst-case scenario would be that the possibility on January 1st the number of uninsured Americans actually goes up instead of down. And the article points out that even a small number of people who can't replace their coverage and they end up uninsured on January 1st would send Obamacare right back into PR hell. So do you agree with that? Because, again, it was a small percent, 5% of this country that were getting purged off their insurance carriers because of being on plans that were unacceptable to the bottom line foundation of the ACA. So if January 1st rolls around and as Politico points out that those people exist as uninsured and problematic, is that another PR problem?
I think you're dealing in large part in semantics there, Thomas, because a lot of those people, they did have policies that didn't meet the minimum standards. That's just not a theoretical discussion. There's a reason you have minimum standards. There are people out there who have insurance who it's an illusion of coverage. I mean, they have immense deductibles. They have annual and lifetime caps. There's so many people out there with what I call phony insurance policies, and the fact that they're going to lose those policies sooner or later, I think is a good thing, because what we're up to here is we are strengthening the healthcare system in this country. We're strengthening the hospitals that end up eating all of that uninsured care that they end up doling out.
Right.
In northeastern Pennsylvania, we've lost 2 hospitals in the last 2 years just because, and they've been circling the drain for a long time because of all of that uninsured care that they have to keep absorbing.
Well, as you point out, with certain people that have these, junk insurance policies, the insurance policies that they only find out are unacceptable in worst-case scenarios when they go to cash in on them or try to get coverage that they need. But I know, as you say, that this is just semantics in certain language, but for certain human beings, certain Americans, this is, it's downright people that are going to find out that they have this problem come January the 1st. But I do want to point out that there is an improvement, and have been many improvements to the website to this point now, that we've got Consumer Reports praising what it called the incredibly useful new browsing feature that allows consumers to shop their plan choices, saying it works perfectly. So what kind of feedback are you getting in Pennsylvania specifically? Because that is a state that does have to rely on the federal website.
Well, first I would say that's probably the biggest and most important feature of the website, other than that it is working now, is that you can compare apples to apples. Mm-hmm. We've had since, I think, 1940 this McCarran-Ferguson law that allows insurance companies an exemption under the antitrust laws. In other words, it suppresses competition. What the ACA does is it enhances competition because you can see policies stacked up right against each other. That is a wonderful thing. What am I hearing from the folks in my district? The people who are uninsured, the people who have pre-existing conditions. In Pennsylvania alone, we have 2.4 million people with pre-existing conditions. Mm-hmm. These are the winners in this whole situation. I was talking to a gentleman who has age-onset diabetes, and he told me that because of that, it wasn't because he was obese. He was not. He was just age-onset diabetic. It was costing him $1,800 a month to have health care coverage. He said he looked into it. That was more than people with pacemakers. And so under the new system, he's not discriminated against because of his age-onset diabetes, and he pays a much more reasonable rate.
It's a marathon, not a sprint, to get our health care on this, in this country back in track and certainly back in line economically. Pennsylvania Congressman Matt, thanks so much. In this program, we note that I want to pass along, if you missed